Welcome to the deep dive. Okay, here's something you might find a bit surprising.
Oh, yeah.
Yeah, anemia not having enough red blood cells, it's, well, relatively common in adult dogs,
We see it quite a bit.
but it's actually pretty rare in adult cats.
That's true. Interesting difference, isn't it?
It really is. So, okay, let's get into this because today we're really focusing on one specific type, iron deficiency anemia.
Right, the kind caused by ongoing sort of external blood loss.
Exactly. And we're mainly looking at dogs here. We've gone through the medical info, the stuff that lays out the basics.
What it is, the signs, the causes.
Diagnosis, treatment, all that. Our goal really is just to pull out the key things so you get a really solid handle on this type of anemia, how it's spotted, how it's managed.
And what's really fascinating, I think, is that the anemia itself, it's almost just a symptom, right? Like the tip of the iceberg.
Okay, yeah.
It's the why behind it, the
Yeah.
reason for that low red blood cell count. That's the crucial bit.
So with this type, the iron deficiency from chronic blood loss.
Yeah, the idea is pretty straightforward.
Yeah.
Your body needs iron to make red blood cells.
Right.
If it's constantly losing blood, it's constantly losing iron, and eventually it just can't keep up production.
So the big takeaway then, like you said earlier, is finding this specific anemia is like a big flashing sign.
Exactly. A sign saying, hey, look over here. We need to find out where this bleeding is coming from.
Right. So who's most likely to get this? The sources say pretty common in adult dogs.
Yep, adult dogs are definitely the main group we see this in.
But what about cats? Should cat owners be just as worried?
Generally speaking, no. For adult cats, this specific kind of iron deficiency anemia from blood loss is, well, it's quite unusual.
Huh. Any idea why the difference?
It's not totally clear, but it might have something to do with maybe their diet or subtle differences in their digestive systems compared to dogs. Maybe they're just less prone to the types of chronic bleeding that often cause this in dogs.
Okay.
But it's worth a quick mention.
Mm.
Very young kittens, say between 5 and 10 weeks old,
Yeah.
they can get a temporary iron deficiency. It's more about rapid growth outpacing their iron intake. But that usually resolves on its own. Different situation.
Gotcha. Okay, so back to dogs. For owners out there, what might they actually see? What are the signs that make you think, maybe something's up?
Well, often the first things are, quite general. Maybe the dog's just more tired than usual,
Mm-hmm.
lethargic.
Okay.
Seems a bit weak, maybe breathing faster, panting more when they haven't exercised much.
Standard not feeling well signs.
Exactly.
Yeah.
But since we're specifically talking about blood loss, there are some more direct clues.
Sure.
One really key one the medical info points out is intermittent melena.
Melena. Okay, translate that for us. What does that actually look like?
Right, sorry. Melena is basically a dark, tarry stool.
Terry.
Yeah, think almost black, sticky, like tar. It happens because blood that's been digested, usually from higher up in the gut, like the stomach or small intestine, turns that color.
Okay, so that's a definite red flag.
It is. And another thing, maybe more obvious sometimes, is seeing a really heavy load of blood-sucking parasites, like a serious flea infestation or lots of ticks.
Right, that makes sense. So we see these signs, maybe the dark stool. What's usually causing the slow, steady blood loss? What are the common culprits?
Well, as we said, the root issue is that constant loss of blood. Looking at the common underlying reasons, a few big ones stand out in the medical literature.
Like what?
Gastrointestinal lymphoma is one. That's a type of cancer in the digestive system.
Okay.
Another major one is hookworms. Those little intestinal parasites, they latch onto the gut lining and, well, they feed on blood.
Nasty little things.
They really are. And unfortunately, other kinds of tumors in the GI tract, gastrointestinal neoplasia, can also cause chronic bleeding.
Wow, those all sound pretty serious.
They are, yeah.
Are there less common causes? Things that might not immediately spring to mind?
Yes, there are a few. The sources mention things like severe skin problems, like a really, really bad flea infestation that's been going on a long time.
It'd have to be pretty bad, though, right?
Oh, absolutely. Extensive. Bleeding somewhere in the urinary tract is another possibility, less common though.
Okay.
And interestingly, they also list overusing a dog as a blood donor.
Really?
Yeah, which, just highlights how important responsible blood donation practices are.
Definitely. Okay, so a vet suspects this type of anemia. How do they start figuring things out? What's the diagnostic process like? Like detective work, right?
Exactly. It is a bit like detective work. First step is ruling out other reasons for the anemia,
Mm-hmm.
especially sudden, big bleeds, acute hemorrhage that's different from this chronic picture.
Right.
Then you also have to think about Sometimes microcytic anemia, small red blood cells can happen with liver shunts, cortisystemic shunts. That's a different mechanism.
Okay.
And there's something called anemia of inflammatory disease or anemia of chronic disease.
Is that different?
Well, the body might actually have enough iron stored away, but it can't use it properly to make red blood cells because of inflammation somewhere else. It's like the iron is locked up, sometimes called functional iron deficiency.
Can a dog have both? Inflammation and actual iron loss?
Yes, absolutely. That can happen, and it definitely makes diagnosis trickier. But often, the clinical picture, are we seeing clear signs of blood loss like melena, or more signs pointing towards inflammation gives us our first big clues.
Okay, so blood tests must be huge here. The CBC, the complete blood count. What are vets looking for there?
Oh, absolutely fundamental. The CBC is key. So typically you'll see a low packed cell volume PCV.
That's the percentage of red blood cells.
Exactly.
Yeah.
In dogs with this, it often drops somewhere in the, say, 10 to 40% range, sometimes lower in severe cases.
Okay.
Now, the body might be trying to compensate, making new red cells. We call that regenerative anemia. Or sometimes the bone marrow response is kind of sluggish and it's non-regenerative.
EO is possible.
Yes. But a really, really important clue is microcytosis.
Meaning small cells.
Small red blood cells, exactly. On the CBC report, this shows up as a low or maybe low normal mean corpuscular volume, the MCV.
Right.
And you'll also usually see more variation in the size of the red cells. That's measured by something called the RDW, red cell distribution width, which will be increased.
Yeah.
Or you might see it on the erythrocyte histogram. It looks wider.
Okay, MCV down, RDW up. That screams small cells.
Pretty much, yeah. It's a hallmark of iron deficiency affecting red cell production.
You mentioned technical terms there. Are there other visible changes to the red blood cells themselves, like under the microscope?
Yes, good point. Besides being small, the cells might also look paler than normal.
Paler.
Yeah, called hypochromia. It's because they don't have enough hemoglobin, which contains the iron and gives them their red color. So they look like they have a bigger pale spot in the middle.
Makes sense.
You might also see some oddly shaped red blood cells and things called keratocytes or schistocytes sometimes pop up, though they can be linked to other things too.
Okay.
And interestingly, some of the newer hematology analyzers have these indices like MCVR and KHR.
More acronyms.
I know. But they're actually pretty useful. They can be even more sensitive at picking up that iron-limited state, sometimes even before the MCV drops significantly.
So earlier detection, maybe?
Potentially, yeah. But it's important to remember, even with all these tests, sometimes it's hard to tell just from the CBC if it's true iron deficiency from loss or that functional deficiency from inflammation we talked about.
Oh, okay.
The lab tests point you strongly in a direction, but they can't always perfectly separate those two just on their own. That's why the whole picture of the dog's signs, other tests, is crucial.
Got it. You also mentioned MCHC before, mean corpuscular hemoglobin concentration. Is that useful?
You'd think it would be, since the cells are paler, but actually MCHC isn't always a reliable indicator of these cases, technical reasons, but it often stays normal even when the cells look hypochromic.
Interesting. Okay, anything else on that CBC that might wave a flag for blood loss?
Well, sometimes you might see the platelet count go up. That's called thrombocytosis.
Higher platelets, why?
The exact reason isn't always clear, but it can be a reactive change seen with iron deficiency or bleeding. And often, with ongoing blood loss, especially from the gut, the total protein level in the blood might be low to hypoproteinemia.
Because they're losing protein along with the blood cells.
Exactly.
So beyond the CBC, any other lab tests that help nail the diagnosis?
Definitely. Measuring iron levels directly in the blood serum can be very helpful. Finding low serum iron hypophoramia, usually defined as, say, below 70 micrograms per deciliter.
Okay.
And also calculating the transferrin saturation. Transferrin is the protein that carries iron in the blood. If that saturation is low, typically below 15%, it means there's very little iron actually being transported. That strongly supports iron deficiency.
But you said the bleeding might be intermittent.
Right, that's the catch.
Hmm.
If the bleeding isn't constant, the serum iron levels might actually bounce back to normal sometimes between episodes.
So a normal iron level doesn't completely rule it out.
Exactly. Which is why checking the stool is so important.
For the melena?
For melena, yes, but also doing specific tests. Fecal exams to look for hookworm eggs, and fecal occult blood tests to detect hidden blood, even if the stool looks normal to the naked eye.
Okay. What about imaging? X-rays, ultrasound, do they play a part?
They can be really valuable, yes.
Oh.
Especially if you suspect the bleeding is coming from the GI tract.
How so?
Ultrasound can help visualize the intestines, stomach, look for masses, tumors, thickened areas. Sometimes endoscopy is needed, putting a camera down into the stomach or up into the colon to directly see a bleeding lesion or take biopsies.
Right.
And of course, any further specific diagnostic tests really depend on what the vet suspects is the root cause based on all the initial findings.
Okay, so let's say we figured it out. It is iron deficiency anemia from chronic blood loss. What's the treatment strategy? How do we get the dog better?
Number one priority, absolutely number one, is find and stop the bleeding.
Makes sense.
If you don't fix the underlying cause, everything else is just a Band-Aid. The anemia will just keep coming back.
Right, stop the leaks.
Stop the leak. Then, because the body's iron stores are depleted, you have to provide iron supplementation.
For how long?
Usually until all the blood parameters like the PCV and MCV get back to normal, and maybe for a bit longer to replenish stores.
What if the anemia is really bad, like life-threateningly low?
Yeah, in severe cases, if the PCD is dangerously low, the threshold often used is less than 15%, then a blood transfusion is often necessary.
To stabilize them quickly.
Exactly. You can use whole blood or often packed red blood cells, which is just the red cell component. Buys you time while you address the underlying cause and start iron therapy.
Okay, so about that iron therapy, what are the options? Pills, injections?
Both, actually. Often therapy is initiated with an injectable iron supplement.
Why start with an injection?
Well, in severe iron deficiency, the intestines might actually be quite poor at absorbing iron from food or pills initially. So an injection bypasses that issue and gets iron into the system quickly. Iron dextrin is a common type used.
How's that given?
It's usually a single injection given into the muscle intramuscularly. The dose is typically around 10 to 20 milligrams per kilogram of the dog's body weight. It provides a slow release of iron.
And then you follow up with oral supplements.
Yes, exactly. After the initial injection, you typically start oral iron supplements and continue those for maybe 1 to 2 months, or like I said, until blood work normalizes.
Okay. What about those kittens you mentioned earlier, the ones with temporary deficiency?
Ah, right. Interestingly, with them, their bodies usually start to naturally replenish iron stores on their own around 5 to 6 weeks of age. So specific supplementation often isn't needed, and as we'll mention, can even be harmful.
Got it. So for the dogs needing oral iron, what kind do they usually get?
Common options include things like ferrous sulfate powder. You can mix that in their food, usually dosed around 100 to 300 milligrams total per dog, once a day.
Okay.
Or ferrous gluconate tablets are another choice. A typical dose might be one 325 milligram tablet once a day.
Are there any risks with giving iron? Any situations where you shouldn't give it?
Yes, absolutely. Critical point here. Remember those young kittens.
Yeah.
Giving oral iron supplements to very young kittens has actually been associated with some serious problems, potentially even fatal outcomes.
Yeah.
So oral iron is generally considered contraindicated, meaning it should be avoided in that specific group.
Wow. Okay. That's really important to know.
Definitely.
So once treatment starts, stop the bleeding, give the iron. How do you track progress? How do you know it's working?
Follow-up is key. You need to monitor the blood work, rechecking the CBC periodically.
How often?
Depends on how severe it was initially, but maybe every 1 to 4 weeks. More often in really critical cases at the start.
And what are you looking for on those rechecks?
You want to see improvement. Specifically, you're looking for an increase in the MCV. Those small cells should start getting back to normal size.
Okay.
And you also want to see signs that the bone marrow is responding well, like an increase in the reticulocyte count or volume. Those are the young red blood cells.
And that histogram thing you mentioned, the cell size distribution.
Right, the erythrocyte histogram.
Yeah.
As treatment works, you should see that population of tiny microcytic cells gradually shrink over time, and the main population shift back towards the normal size range.
Does that happen quickly?
It takes time. Red blood cells live for a few months, so it can actually take a couple of months, sometimes longer, for that histogram to look completely normal again, even after the PCV is back in range. Patience is needed.
Okay. So wrapping this up then, this deep dive really hammers home that iron deficiency anemia from chronic blood loss. It's a really significant signal, isn't it? Especially in adult dogs.
It really is. It's basically shouting that there's an underlying issue, often something serious, that absolutely needs finding and fixing.
And it takes a full-on approach spotting those sometimes subtle signs, doing the thorough diagnostic workup, putting all the puzzle pieces together.
And then having a treatment plan that tackles both the bleeding source and replenishing that vital iron.
Exactly. You need both parts. And, you know, it makes you think, Given how many different things could potentially cause slow, chronic blood loss,
Yeah.
what are some really unusual, maybe unexpected scenarios where this might actually show up in a dog or cat? Situations we haven't even discussed today.
Hmm. That's a really interesting question to ponder. Definitely food for thought.
Yeah.
Well, hopefully digging into this gives you a much better understanding of this specific condition. Knowing about these kinds of underlying health issues, even the complicated ones, really helps you be a more informed advocate for your pet's health. Thanks for exploring this with us on the Deep Dive.